A new survey suggests that American consumers may be overconfident in their understanding of over-the-counter medicines. In fact, 1/3 of Americans say that it is acceptable to simply skim the label and not read it entirely. Joining me now is Emergency Department Physician Darria Gillespie, who can share more of these findings. Welcome, Darria.
Thank you, Makiba. It's a pleasure to be here.
Now, first, Dr. Darria, what other interesting findings did this survey reveal?
So this was very interesting, and it was a survey commissioned by McNeil Consumer Healthcare Division. I'm working with them to share the lessons and really empower all of our listeners to take OTC safely and effectively. And it also found that about 40% of people see those labels as suggestions, not really instructions that they need to be following. And some other differentiations. One is that women are more likely to read the instructions on the label than men, and also that Caucasians are half as likely to read the instructions on the label as Hispanic and African American patients.
Wow, those are really some surprising findings.
Really are.
Also, can you share about how the findings vary among different generations as well as different cultures?
Yeah, absolutely. And this may be surprising to a lot of us. And it showed that millennials, 82% of millennials think it's important to read the label on your OTC versus 54% of older adults. And that's exceptionally concerning because older adults may be more likely to be taking more medications as well as having other health conditions. So really supports the notion that we need to be paying more attention to the labels.
Yes, absolutely. And can you go into a little bit more about that? Tell us why it is important for us to read every label every time on our over-the-counter medicine.
It is so important to read every label every time because OTCs are a great resource, and when taken according to the label, they're very safe and effective. I, as an ER doctor, give them to my patients, take them myself, use them with my family. But like any medicine, in addition to the benefits, if not taken appropriately, they can have risks. And the way to do that is to empower yourself. And that empowering information is right there on the back of that bottle to take it and read it every label every time.
Absolutely. Now, you're the expert. Can you share some tips on what important things that people should look for on the labels when they're purchasing over-the-counter medicine?
Absolutely. There's kind of 5 tips I like to give patients and want to give to all of our listeners. Number 1 is an easy one, every label every time. And you may think, I've taken this before. I don't need to look at the label again. In fact, you really should review it. You should look for new warnings if it's a new bottle, and also look at health conditions and the information for that, because your health conditions may be different from the last time you took that medicine. Number 2 is dosage. I want you to look at the single dosage and never exceed that single dosage amount. Also, don't exceed the 24-hour dosage amount. That's very important. A lot of people don't pay attention to that, but I, as an ER doctor, really look at that information. Number 3 is active ingredients. People may say there's so many long words on here. Look at the active ingredients, and especially if you're taking more than one medicine. If it's prescription or OTC, many of them have overlap in their active ingredients. And you don't want to take ever more than one medication with the same active ingredient because you could accidentally double your dose. Number 4 is don't take it longer than recommended on the label. And 5 is if you find that you have other questions or you need to take more than is instructed on the label, talk to your doctor, talk to your pharmacist or other healthcare professional, because they'll need to try to figure out what's going to get to the bottom of your symptoms and give you better guidance on how to control them.
Those are some really valuable tips. Thank you for sharing those. And lastly, doctor, where can people go for more information?
So it's easy to remember because I'm telling everybody to read every label every time. So the website is www.everylabeleverytime.com.
That's great. Thank you so much for sharing that.
Of course.
And just as Dr. Darria said, for more information and tips to safeguard you and your family when buying over-the-counter medications, please visit www.everylabeleverytime.com.
That's it.
Thank you so much, Dr. Darria. It's been a pleasure.
Thank you. Me too. Have a great day.